Hi, welcome to Sri Nandaka Advanced Surgery. Today let's talk about common anorectal conditions. The three most common anorectal conditions are piles, fissures and fistulas. These are the three conditions that we commonly see in the OPD, and now let's talk about how each of these conditions differ from one another. Piles are some of the most common conditions that we see in the anorectal region. Piles are nothing but dilated anal veins or anal cushions that are seen in all age groups. Depending on current lifestyle changes and certain foods that we are consuming on a regular basis, depending on current lifestyle and food habits, we are seeing increasing number of pile patients in our OPDs. The most common cause for any of the anorectal conditions are constipation because of consuming a low fiber diet. Another common anorectal condition that we see in the OPD is a fissure. Fissures are nothing but anal tears which become deeper and deeper until they become extremely painful. Another condition that is commonly seen is a fistula. Fistula is nothing but a communication between the anal canal and the exterior skin. This is usually seen after a ruptured abscess or when an abscess is developed in the anal or the perianal region and we do an incision and drainage of the abscess. It results in a sinus or a fistula. The difference between a sinus and a fistula is the sinus does not communicate with the intestine inside, but the fistula does. Most of these common anorectal conditions are caused due to consuming a low fiber diet and reducing your intake in fluids. By doing this leads to constipation, and constipation further causes these conditions, which are piles, fissures and fistulas. An effective way to treat these conditions in the initial phase at home: consume a diet which is rich in fiber such as green leafy vegetables and fruits. Increase your fluid intake, stay hydrated always. Try to include a little mild exercise in your daily routine. And most importantly, when you have any of these conditions or symptoms such as pain, bleeding or constipation, do visit your regular doctor to get yourself examined and know what exact condition that you're suffering from. If the grade is low, then these conditions can be managed medically. Higher grade of these conditions may require some form of surgical intervention. If you have any of these symptoms or would want to know more about these conditions, please hit us up in the comment section below. Also, do like, share and subscribe this video with fellow members who would want to know more about these conditions.